Fungal infection Candida auris that causes severe illness has spread into Massachusetts. Now, a lot of people are concerned as we're hearing that this is a nightmare deadly disease that is spreading and it is in hospitals. I'm going to be sharing with you information directly from the Center for Disease Control and Prevention, or the CDC, as they're tracking Candida auris, and I'm going to let you know exactly what you need to know and where this currently is. And I let you know just a couple days ago, take a look at this. The deadly fungal infection known as Candida auris, with a death rate of 60%, is spreading rapidly in the United States. One concerned doctor described the deadly fungal infection as a nightmare scenario and warned, "We've never had a pathogen like this in the fungal infection area as it spreads across the United States." Now, this was in Washington state. We're now hearing there are several other states where this is popping up, and now it's in Massachusetts. And the concern is that this can be transmitted and is highly contagious, and the way it's transmitted is by touching surfaces. And they're saying that it actually can last on clothes, people's skin, on various surfaces for up to 2 weeks. So this can last quite some time and can spread very rapidly. And they're saying that if you get it, this fungal disease, it's very dangerous. So I'm going to be sharing with you the latest information so that way you can see it for yourself. I'm going to link the articles in the description, put them on the screen, and read right from them so you know the latest. And also, if you missed my live stream yesterday, you might want to check it out, as we've heard no taxes, no federal taxes for Social Security recipients. There is a new piece of legislation that is out in Congress, and they're saying there's bipartisan support. So stick around to the end for some more information on that. But let's go ahead and dive right in. And before we do me a quick favor. If you appreciate the updates, don't forget, take a second to hit that like button for me. Also, to stay up to date, it's totally free. Why not hit the subscribe button, turn on that notification bell, and to stay connected off of social media platforms, consider joining the newsletter at www.steveramnews.com. But with that being said, you guys, let's go ahead and dive right in and get you caught up on the latest with Candida auris. All right, so we're going to be taking a look at which states this is now in, but first, let's give you a little bit of information regarding Candida auris. As I mentioned, one concerned doctor described the deadly fungal infection as a nightmare scenario and warned that we've never had a pathogen like this in the fungal infection area as it spreads across the United States. This coming out February the 5th. A deadly fungal infection with a mortality rate as high as 60% is spreading rapidly across the U.S., with Washington state confirming its first cases last month. Named Candida auris, doctors have warned that the nightmare rare fungal infection is resistant to medications, has a high fatality rate, and spreads easily in medical facilities. More than 1 in 3 patients infected with the invasive form of the fungus lose their life. The Center for Disease Control and Prevention, or the CDC, has warned. After reporting its first case on January 10th of 2024, the Seattle and King County last week announced a further 3 confirmed infections. Kindred Hospital, Seattle First Hill, confirmed at a time the patients were asymptomatic and being appropriately isolated from the rest of the patient population with extra clinical and cleaning precautions to prevent the spread. Typically impacting those with weakened immune systems, this fungal disease is resistant to several common antifungal medications. First appearing just 15 years ago, the rate of Candida auris has soared in that time. 2021 saw 2,377 confirmed clinical cases in the U.S., a staggering increase of over 1,200% since 2017. Candida auris can cause infections across the body, the CDC has warned, including the bloodstream, open wounds, and the ears. While there is not a common set of symptoms, it may present similarly to a bacterial infection. Those infected with Candida auris may spread the fungus without ever becoming sick themselves. The CDC added someone who is colonized can still transmit Candida auris onto surfaces or objects that they contact, which can then spread to other patients. If a person is infected with the deadly fungal infection, they should avoid anyone who may be at risk and be placed in a room away. The CDC said that Candida auris can be misidentified as other types of fungal infections unless specialized laboratory technology is used. This misidentification might lead to a patient getting the wrong treatment. Now, despite the high fatality rate for severe infections, the fungus is not thought to be dangerous for those that are healthy adults. However, those that are immune compromised, please take precaution. However, last year, Dr. Louis Ostrowski, a professor of infectious diseases at McGovern Medical School at UT Health Houston, warned the spread of Candida auris could cause a nightmare scenario if left unchallenged. It's a potentially multi-medication resistant pathogen with the ability to spread very efficiently in healthcare settings, he said. We've never had a pathogen like this in the fungal infection area. Researchers remain puzzled at the fungus's sudden appearance, with some pointing to climate change as a potential factor in its potency and resistance to treatments. So again, a lot of concern recently as this is popping up and spreading very rapidly. All right, so now let's take a look at the information in the states that have Candida auris, and this information is coming directly from the Center for Disease Control and Prevention, and this was updated just yesterday. It says tracking Candida auris. Candida auris is an emerging fungus that presents a serious global health threat. The CDC tracks the number of Candida auris cases in the United States over time to assess the impact of prevention strategies and inform public health practices. In the United States, most cases of Candida auris result from local spread within and among healthcare facilities in the same city or state. However, healthcare facilities should be on the lookout for new introductions of Candida auris from patients who receive healthcare elsewhere in the United States or abroad in areas with Candida auris transmissions. Now, the following information is based on Candida auris case counts provided by local and state health departments to the CDC every month. This data is summarized in a map. The data tables below include clinical Candida auris cases from 2013, the year of the earliest known U.S. cases. Now let's take a look at the map, and this is only showing you the last 12 months, so essentially this is the year 2023. Now you can see in 2023 that it was prevalent in California, Nevada, Texas, Florida, Illinois, New York. There were also a lot of cases in Indiana and Ohio and New Jersey. There was a little bit less severe number of cases in Arizona, Georgia, Kentucky, Michigan, Virginia, Pennsylvania, and Maryland, and lighter cases in New Mexico, Colorado, Minnesota, Wisconsin, Louisiana, Mississippi, Alabama, Tennessee, Massachusetts, and Delaware. Also, they had this in Hawaii as well. And one known case in Iowa, and now we're also hearing in Washington, it is popping up in the year 2024, and they're saying that the spread is becoming greater and greater. Now, all the other states that you see in gray, there have been no cases that have been identified as of yet. So let me know your thoughts in the comments down below, as they're saying that if you're in good health, for the most part, you should be okay. However, the concern is that you could be a carrier of this. You could transmit it from your skin, your clothes, touching surfaces to others. That could be susceptible to really this being very dangerous. And they're concerned that this could spread, and they're seeing this spread even more and more rapidly, and it is in the hospitals where people are immune compromised or sick at the moment, and they're saying that this is spreading. So let me know your thoughts. Now, as more information comes out, and we're hearing that more states are getting this, I'll be sure to share so that way you know the latest here on the channel. And also, people are concerned about Disease X, the white lung disease. COVID is still spreading. I'm just recovering from it. I just caught it last week. I'm finally feeling a little bit better, but I will keep you up to date on all of this as it comes out. Now, in addition to that, we're also hearing that Congress is working away on legislation as we approach elections, and one of them is to eliminate taxes, federal taxes, on Social Security benefits received by recipients. They're saying, why are people receiving double taxation? Taxed when they put in and taxed when they pull out. Well, to get the latest on that legislation that has come out, be sure to check out this video right here next, as I covered it in detail for you, and also provide more information on that as well. As I cover this live, I'll also provide more information in an upcoming video. So don't forget to subscribe to stay up to date. But with that being said, you guys, thank you so much for joining me, and I'll catch you in the next one. Take care. God bless. This is Steve.